Good morning, everybody. My name is Janet Farmer. I work for Celebrate Birth and Client Financial Services, and I'm also a student midwife. And I'm coming to you in the wee hours of the morning because I'm on my way to school, and I wanted to talk to you about the fact that babies are often night people. So, little tip, in case you didn't know, babies like to be born in the night. Sometimes they come in the day, that's true, but more often than not, we find that babies come overnight because they're active at night, they're awake. Have you ever noticed that when you lay down at night to finally get some rest, that your baby belly just starts going all over the place because your little one is awake and active and ready to play? Well, that doesn't change much after they're born. Now, the first 24 hours after birth, they will be a little sleepy. They'll wake up for that first hour after birth, and they'll want to spend time with you and get to know you and snuggle and feed and things like that. But after about an hour or so, they're going to get sleepy, and they're going to sleep a lot in that first 24 hours. And you're going to think, wow, we have the best baby ever. Our baby just loves to sleep. And that's true. You do have the best baby ever, but that's just a little sleep period. And baby is going to wake up after about that 24-hour period. And that's just going to be about when you get really tired, because it's possible that you were up for a day and maybe even the overnight having the baby. And then you get home and you're finally able to get maybe a little bit rest, but then baby has its awake time. And that could happen for 2 or 3 nights in a row, and even longer, but that really awake time where maybe they're a little hard to console, they need a lot of snuggle time and being held and loved on, and just want to let you know that's totally normal. Baby may even cry quite a bit after that second and third night. They're just adjusting to life outside the womb. And they're going to want to be held, but you're going to be really tired. So my tip for you is to consider having some help when you go home. Those first couple of days, overnight can be really rough when both mom and dad are exhausted. So if you have a mother or sister or friend, someone that you feel is pretty comfortable with handling a newborn, and can also manage to stay awake overnight, because the baby may need to be walked around, held quite a bit, so you're going to need somebody that can stay awake. If you don't have anybody that you feel can fill that position, you might want to consider a postpartum doula. I'm sure many of you have heard of labor doulas, professional support people that come in and help you during your labor and birth in a non-clinical manner. They offer labor support. Well, there are also postpartum doulas. So postpartum doula would come to the home, and it could be during the day or overnight or both. And their specialty is helping mom recuperate from the delivery. But beside that, they're specialists with taking care of newborns as well. So their role would be to, be keeping an ear out for the baby overnight while you're getting some sleep. The doula could bring the baby to you to feed, then go ahead and change the baby, whatever else needs to be done, and put the baby back to sleep, or go ahead and just hold the baby and walk with the baby, or whatever needs to be done to console him or her. So anyway, just wanted to give you that little tip. Babies are night people, so don't be surprised by that, and don't be surprised if they don't want to sleep a lot at night for a while, and just plan for it. Just be aware that you're going to need to nap during the day when the baby is napping, because it might be a long night. But those first few days, just get lots and lots of baby snuggles, as much skin to skin as possible. Feed as often as you can, every couple of hours. You're going to be feeding, so there's not a lot of sleep for you. So when you can sleep, do it. And plan on getting some help those first 2 or 3 nights home. You're probably going to need it. Thank you, and have a great day. I'm off to school.